Hello everybody. The goal of the next minutes is to say a few words about myself. I would describe my person as an abdominal surgeon, as a very active one. I am a doctor that is very much inclined to find a solution even for advanced cancer cases, and my prime motive is never to give up. I was born in 1961 in the former part of East Germany near Berlin. My parents escaped a few years later to the western part at that time of Germany. I was studying medicine later on at the University of Heidelberg and did my last year of clinical training at the University of Texas at San Antonio for about 1 year. After that, I moved to Harvard University in Boston and stayed there for 2 years as a research fellow, and then returned to Heidelberg University to do my surgical training in abdominal surgery, transplantation surgery, and in vascular surgery. In 2011, I decided to move to the Hirslanden hospitals here in Zurich in Switzerland and quickly joined the team of the oncology unit here at the Gastrointestinal Tumor Center in Zurich. The main goal of this center is that we are all pretty young doctors that are very much motivated in their own fields, and we have very short communication pathways that avoid unnecessary information leakage through many connection points. So it's a very close circle of people that are very dedicated to what they do. And I would describe myself as a member that is very active and try to push the treatment of cancer patients to the limits, because we treat many advanced cases, even desperate cases, and fortunately in many of these cases we find a solution or to help the patients, in some cases even to cure the patients. But the prime sentence is never to give up. I think that's very important to have an honest communication with your patient. That's also very important, even if it's not so good news that we have to deliver sometimes. On a more private level, I'd say I love nature. Even as a young boy, I was running around with glasses and watching birds in the nature. I like classical music. And since I have 4 children, nowadays most of my private time is taken up by the family. But that's, of course, normal, and I love that most.